Module Overview: Medical ethics and patient rights are foundational principles that underpin every action, decision, and interaction in nursing and healthcare delivery. In this module, you will explore the moral frameworks, ethical obligations, and legal expectations that govern the conduct of nurses and healthcare practitioners, especially in Europe's diverse and human rights-centered healthcare systems. This module provides a structured and critical examination of ethical theories, EU legal principles, national patient rights charters, and professional nursing codes of conduct across multiple European Union member states. The aim is to equip you with the ability to recognize ethical dilemmas, apply ethical reasoning, and respect the autonomy and dignity of all patients. You will learn the practical application of ethical values such as confidentiality, consent, non-maleficence, beneficence, autonomy, and justice, as well as the rights patients hold in relation to care access, information disclosure, privacy, and medical decision-making. 1. History and foundations of medical ethics. The Hippocratic Oath. Origins and relevance today. Florence Nightingale's ethical legacy in modern nursing. Evolution of bioethics. From paternalism to patient-centered care. The Nuremberg Code and post-WTO II ethics in Europe. UNESCO's Universal Declaration on Bioethics and Human Rights. 2. Core ethical principles in healthcare. Autonomy, respecting patient choices and informed consent. Beneficence, promoting well-being and acting in patients' best interests. Non-maleficence, avoiding harm and injury. Justice, ensuring fairness in care access and treatment. Fidelity, maintaining trust and faithfulness in caregiving, ethical versus legal obligations, intersection and divergence. 3. Informed consent and capacity components of informed consent, disclosure, comprehension, voluntariness, legal requirements for consent across EU nations. Special populations, minors, unconscious patients, cognitively impaired individuals, refusal of treatment, and the right to die debates. Advanced directives and living wills. Germany, Netherlands, France. 4. Confidentiality and patient privacy. Importance of confidentiality in the nurse-patient relationship. Data protection standards under General Data Protection Regulation, GDPR. When breaking confidentiality is ethically or legally permissible use of electronic health records and privacy risks. Real-world examples of data breaches in European Union hospitals. 5. Ethical dilemmas in nursing practice. End-of-life decisions, withdrawal of care, palliative sedation, allocation of scarce resources, ICU beds, organ donations, reporting medical errors versus protecting professional relationships, treatment refusal due to religious or cultural beliefs, caring for terminally ill children or adults with disabilities. 6. Patients' rights in the European Union. European Charter of Patients' Rights. 14 rights including access, information, consent, privacy, redress. National charters in Germany, France, Sweden, and Poland. Rights of migrants, asylum seekers, and undocumented persons. EU legislation on cross-border healthcare, right to second opinion, and free choice of provider. 7. Professional codes of conduct. International Council of Nurses. ICN, Code of Ethics, EU, Federation of Nurses Associations, EFN, Standards, National Regulatory Bodies, NMC, UK, OEGKV, Austria, ANFN, France, Ethical Accountability and Professional Misconduct, Disciplinary Processes and Whistleblower Protections. 8. Cultural and religious considerations. Culturally sensitive care, respecting traditions, languages, customs, balancing secular EU laws with personal/religious beliefs, ethics of treating patients with conflicting values, ethical competence in multicultural societies. Case study, Jehovah's Witnesses and blood transfusion refusal. 9. Legal case studies and precedents. The Tony Bland case, UK, withdrawal of life support. The Baby Charlie Gard case, UK. Parental rights versus medical judgment. European Court of Human Rights. Rulings on consent, refusal, death with dignity. Case of forced treatment. Legality and moral implications. Legal liability for nurses. Negligence, malpractice, omission.